Hi everyone, I'm Dr. Robin Chetkan. Welcome to today's live office hours. Today I'm going to be talking about the impact of different hormones on the gut. So I frequently talk about the impact of the gut on other hormones, but today we're going to mix it up a little bit and talk about the impact of hormones on the gut. So welcome everybody. And the first thing I want to point out is that for most hormones, we have what we call positive and negative feedback loops. What does that mean? It means that let's talk about the thyroid, for example. So you have a hormone that's released from the brain called thyroid stimulating hormone, and that hormone acts on the thyroid gland. And then the thyroid gland puts out active hormone, T4, T3. We don't have to get into the specifics of which kind of thyroid hormone and what it does. But the point is that the thyroid stimulating hormone, which is released from the brain, stimulates the thyroid gland to produce hormone, circulating hormone. If those levels of circulating hormone are higher than they should be, the brain will then reduce the amount of thyroid stimulating hormone, TSH, so that the thyroid gland will start producing less. Now, this is where I'm going with this. Let's say you were taking an external form of thyroid hormone. Let's say you have been diagnosed, appropriately or inappropriately, with an underactive thyroid, and you are now taking a form of T3 or T4. Your bloodstream is going to have high levels of the thyroid hormone. Let's say you were diagnosed inappropriately and you were taking extra thyroid hormone. Now your bloodstream is going to have higher than normal levels of thyroid hormone, and your brain is going to go, there's too much thyroid hormone on board. We don't want the thyroid putting out as much hormone. We are going to decrease the thyroid stimulating hormone that's driving the thyroid, and that's going to drop. So this is an example of feedback loops, and for many of the hormones in our body, whether we're talking about insulin, whether we're talking about estrogen, progesterone, etc., they're feedback loops. And so one of the things I want to point out is that we do have to be careful with how we take exogenous hormones. And by exogenous hormones, I mean hormones that are not being made naturally in our body, they're being manufactured. Now, if your thyroid gland has been removed, that's a different problem. You have to take some exogenous thyroid replacement. But what I see in my practice is a lot of people are being diagnosed with these hormone deficiencies using tests that are really not clinically validated. Or we have practitioners who are saying, oh, your level is lower limit of normal, you need more, with this mentality that the higher the better. That's not always the case. In fact, that's often not the case. You can end up with supra-therapeutic levels, too high, and that can throw off production. So what I remind people is if you're taking external thyroid hormone, which let's face it, is never going to be as good as your body's own native thyroid hormone that it's producing just for you, customized, that can actually suppress your thyroid gland because, again, your brain is going to sense higher levels of thyroid hormone in the blood, and it's going to cut down on your production of TSH, and your thyroid is going to produce less native hormone. So you always want to go with, what your body's producing because it's customized just for you. And you have to be careful how these external hormones, you might think you're sort of boosting your thyroid hormone production, but in reality, you may be suppressing it because the feedback loop is being suppressed by the fact that there's additional exogenous hormone, synthetic hormone that it is sensing. So these feedback loops are important. When we think about the hormones that affect gut function, of course, we think about the thyroid, and generally speaking, and this is quite an oversimplification, but generally speaking, an underactive thyroid gland, hypothyroidism, meaning not enough of the T3, T4, and generally in that state, just to confuse you, the TSH level is high because when the thyroid gland isn't putting out a lot of hormone, the brain increases secretion of TSH to try and drive that thyroid. So the diagnosis of hypothyroidism, an underactive thyroid, would be a high TSH and low levels of circulating thyroid hormone. And that's typically associated with constipation, with sort of slow transit and small bowel movements and general constipation, slow, sluggish bowels. Hyperthyroidism, on the other hand, high levels of the circulating active thyroid hormone and low levels of TSH because why? your bloodstream has high levels of thyroid hormone, so your brain is saying, okay, we don't need to drive that thyroid gland anymore. So that diagnosis would typically be associated with frequent bowel movements, sometimes diarrhea, not typical though, but more frequent bowel movements, and other signs too. There are issues of heat intolerance, cold intolerance, etc., dry skin that can be associated with thyroid disturbances. But here's where it gets really interesting. A dysbiotic gut, so a gut where the gut bacteria are really out of balance. Let's say you've had way too many courses of antibiotics and you have some yeast overgrowth and you've killed off a lot of the beneficial gut bacteria. That state of imbalance, as we're learning, is associated with multiple different disorders. I have a slide that I love that shows the gut, the center, and then it shows the brain and things like Parkinson's and mood disorders, and the skin and eczema and psoriasis. And it shows, of course, the gut, ulcerative colitis, Crohn's. It shows autoimmune diseases, heart disease, kidney problems, bone issues, issues with the skin, the lungs, the respiratory system, etc. So we know that the gut is central to a lot of these different organs. And when the gut bacteria are off, digestion and assimilation of different nutrients is also off. And that means that those substances that are really fuel for the rest of the body are not being properly assimilated and delivered to distant organs. And that's why a problem in your GI tract can end up affecting your bones or your brain, right? It's all connected. And that's a whole concept of integrative gastroenterology. So we know that dysbiosis is a major player, for example, in autoimmune type thyroid disease like Hashimoto's and Graves' disease. And with Hashimoto's thyroiditis, where there's inflammation of the thyroid, it's considered an autoimmune disease. We can see this in different states, sometimes around pregnancy, etc., when there are also other hormonal changes I'm going to get into. But we know there is an association there, and that this imbalance, this sort of disordered gut microbiome, can affect the thyroid function. And conversely, an unhealthy thyroid can affect gut function and what's going on with the gut bacteria. So there's a lot of communication, and we really have to think when we do things, when we intervene, whether it's a drug, a supplement, or hopefully a dietary change, we have to consider what is the downstream effect on these other organs. And of course, the thyroid gland, what's going on in your thyroid, can affect metabolism of other substances in your body, calcium, magnesium, etc. So I like to think of the thyroid as air traffic control. And of course, there are other hormones. So female reproductive hormones can have a big impact on the GI tract. And what am I talking about? Primarily estrogen and progesterone. And here's the thing, it's not just the level of one hormone versus the other. So, evaluating what's going on isn't just a simple matter of going to the lab, getting blood drawn and saying, okay, my estrogen level is here and progesterone level is here and it should be, somewhere else. Because why? Because there's a cycle, right? Your follicular phase where you have menstruation, and then there's a luteal phase, etc. So during these different phases of your menstrual cycle, if you are a menstruating woman, the levels of hormones are going to fluctuate. And that's why for so many women, they have fluctuating GI symptoms too during their menstrual cycle. They find them more bloated, more constipated right before their period. And then once things start to flow and they move through the follicular phase, as the hormone levels change, they become less bloated and constipated. So that's very, very common. But even postmenopausally or perimenopausally, what happens there is that levels of both estrogen and progesterone fall, but progesterone falls more. So you end up with relatively more estrogen on board, even though estrogen levels are dropping. And so that's a situation that we call estrogen dominance. And there are other times in life that you can have estrogen dominance too. We know that exposure to what we call xenoestrogens, meaning estrogens made outside of the body, birth control pills and hormone replacement therapy being two very common examples, can also affect estrogen levels and can cause estrogen levels to be higher than they normally should be. And we know there's a lot of bloating and fluid retention that's associated with that. Now, you may be on hormone replacement therapy. Maybe you had your uterus removed surgically. Maybe you're going through menopause and your OBGYN recommended it, and it may be taking care of some of the symptoms of menopause, like the vasomotor episodes, otherwise known as hot flashes, or the vaginal dryness, or whatever else it is. But you may also be experiencing more GI symptoms as a result of that. So something to keep in mind. I'm not saying you shouldn't take it. Whether you should or shouldn't take hormone replacement therapy is a very personal decision that has a lot to do with your personal history, your family history, your symptoms, etc. So it's a decision that's best made in conjunction with your OBGYN, considering all the different factors. But I just want you to be aware that birth control pills and hormone replacement therapy, depending on the amount of estrogen in them and the ratio of estrogen to progesterone, can be the cause of a lot of GI symptoms, as well as something that we call insulin resistance. And we see this a lot with birth control pills in particular that contain a lot of estrogen. And the insulin resistance is usually manifested as weight gain, which is why when I'm seeing women who are on a birth control pill and they're describing more than a 5% in weight gain over the few months when they start the pill, I will usually recommend they be evaluated for insulin resistance because, again, all this stuff is connected. So your estrogen levels can actually affect what's going on with your insulin secretion, and vice versa. Insulin can affect where the fat in your body is being deposited. High levels of estrogen can lead to more abdominal fat deposition, and so can high levels of insulin. So these hormones do a lot of different things in different parts of the body, and what we're always in search of is balance. It's like gut bacteria. The goal is not to, stock your gut full of only a certain kind of bacteria. That would be a very bad thing. The bacteria all do different things. So we want to make sure that we have a diverse microbiome where all these different species are well represented. And the same with these hormones. And that's why I get really worried with some of this supplementation where I see people taking thyroid hormone where, I look at their thyroid testing and I'm like, this is pretty normal. And I'm concerned that now you're creating some imbalance, or somebody taking the pill and having a lot of GI symptoms and not recognizing that the pill is responsible for some of these symptoms. So lots of ways this can affect you. Typically progesterone, if we think about pregnancy, which is another state where the hormones are changing, progesterone levels in pregnancy can be associated with relaxing of the smooth muscle, but also a decrease in gut motility. So in pregnancy, we are seeing that, there's increased abdominal girth because of the baby, the pressure of the uterus, and that can be pressing on the bowels. The change in progesterone level can cause more relaxation of the smooth muscle and a decrease in gut motility. And sometimes the diet is changing during pregnancy. Sometimes there's dehydration because a lot of the fluid you're drinking is being used to replete the amniotic fluid. So pregnancy is a really sort of specific time where hormones are moving, things are shifting, and there can be some shifting in the GI tract too. It's one of the times I really enjoy interacting with pregnant women, because even though I've delivered a bunch of babies when I was a medical student and I've been a doctor for decades, it is to me still this miraculous thing that, we can cook a human being up in our bodies. So that's always fun. And of course, when the baby comes, it's always amazing. Okay, what else did I want to tell you? So we talked about estrogen dominance and xenoestrogens, which are, again, estrogens that are made outside of our body, can come not just from birth control pills and hormone replacement therapy, but also from chemicals. So things in household cleaners, dry cleaning fluids and chemicals. And so these things are what we call endocrine disruptors, meaning they disrupt our endocrine system. So our hormones, not just the ones I talked about, but also others. And, some of them are associated with birth defects and some worrisome things, but we want to try and limit that. So we want to pay attention, for example, to the chemicals we're using in our home. Household cleansers, use gloves when you're interacting with those chemicals, or try and avoid them altogether. We have on the Gutless blog, we have some great recipes for vinegar and lemon and lavender and different household cleaners you can use. Though when I asked the lovely lady who helps us with house cleaning to use that stuff, she looks at me and she goes, yeah, that stuff doesn't work. Give me some Clorox bleach. So it's true, sometimes these homemade cleansers are less effective, but I'll tolerate a little more, sort of cruddy looking grout to avoid some of these chemicals because they can be absorbed. And particularly I have a teenage girl at home, not so young. And so I'm particularly concerned about the effects of some of these chemicals in people of reproductive age is something that we have to pay attention to. So how do we go about sort of, altering these hormones, if you will? Is there a safe way to do that, to manipulate things if we're having GI symptoms? Well, there is, but again, you always have to think about the downstream effects, right? So if let's say, for example, you menstruate and you have severe cramps and you have severe constipation and bloating right around your period, and you decide, I want to do away with my period. I want to, suppress ovulation and stop having a period, and you go on some kind of birth control pill where you don't get a period for long periods of time. And you might feel better GI-wise, but you also have to think about the impact of not ovulating, right? What that has on your downstream fertility and overall reproductive health, because there's a big question mark there. But when you think about women who suppress ovulation for 10, 20 years on the pill, and then try to get pregnant and are told by their doctors, guess what? You're not ovulating. You got to think there's got to be some relation there, right? I suppressed ovulation for 20 years and now I'm ready to ovulate, but I'm not ovulating. Could it have something to do with the fact that my ovulation was suppressed for a long time? What I find as a gastroenterologist, because I'm going to try and stay in my zone as a gastroenterologist, not an OBGYN, but they're downstairs next door neighbors, the female reproductive tract and the gastrointestinal tract. So it's hard to practice in a vacuum where you're not considering that. What I find for a lot of my GI patients who have autoimmune diseases like Crohn's and ulcerative colitis, I find that they are worse when they go on the pill. Their GI symptoms and their GI disease flares. And while Crohn's and ulcerative colitis are typically diseases that are more active in the second, third, and fourth decade, even menopausally, when many autoimmune diseases tend to quiet down as the immune system becomes less active, even for some of my menopausal and postmenopausal women, if they go on hormonal therapy, sometimes it can cause a flare in their Crohn's and ulcerative colitis. Now, that being said, many women don't experience any worsening of the symptoms at all, and some experience improvement in symptoms with having an anovulatory cycle where they're not ovulating actively. But these are things you definitely want to discuss all the pros and cons with your OBGYN or whoever's doing the prescribing, and think about these issues around estrogen dominance, pregnancy, menopause, menarche, etc. One of the other things I want to point out is that as we are fortunate enough to age, to move through the years, our bodies are different, right? So think about menarche, which is the onset of menstruation. Most girls are somewhere between 12 and 15, let's say on average 13, 14 with menstruation. They're different before and after. If you've raised a girl or, been a girl yourself, right? You might not remember, but you know that as they go through puberty, things change. The oil glands start to secrete more. They can have acne. They get kind of smelly because the oil glands start to secrete more, and that's mixing with bacteria in areas like the underpits of groin, etc. And, they grow boobs and they menstruate and all these different things. And from a GI point of view, things change around menarche in terms of what people will be able to tolerate well versus not. And we see similar changes at menopause. And so here's the thing. People often say to me around menopause, and remember, perimenopause is like the 10 years before your period actually stops, where things are changing hormonally, but you may still be menstruating. So let's say if average menopause is around 50, early 50s, think of perimenopause starting at 40, early 40s. And women will come in saying, I don't know what's going on. I'm gaining weight, I'm bloated all the time, and I haven't changed a thing. I'm still eating the same, I'm exercising the same, but things are changing. Well, things are changing because the body's changing, and so you have to change in response to that. So one of the things that changes is insulin resistance. So we often become a little more insulin resistant as we get older. What does that mean from a practical point of view? It means just looking at food, you're going to gain weight. In all seriousness, though, it means that typically you will have difficulty gaining weight. Food that you ate in the past, particularly food that, if you had a very carbohydrate heavy diet and your weight was stable, you might find now that that same level of carbohydrates, particularly if they're not a lot of complex carbs, you're gaining weight. You may not have to change what you're eating, but you may have to change how much you're eating. You may have to move to smaller portions, to eating earlier. You might find that hormonally, your digestive tract is even less active later in the day. Everybody's is to some extent, because our GI tract motility is tied to the circadian rhythm, the light-dark cycle. So everybody has some element of that, but you may find even more that you have to really calorie shift and eat earlier breakfast, bigger breakfast and lunch, lighter dinner, in order not to be uncomfortable, not to gain weight. You may find menopausally that foods that you tolerated fine in the past are now giving you a lot of gas and bloating. So it's important to be reactive to that. the same way we see with our younger girls at Menarche, when things change and they get their period, that they're different, right? And we treat them a little bit differently. They maybe eat differently, they look differently, they smell differently, etc. They are changing. Well, we are also changing menopausally, and we have to respond to that if we want to stay really healthy, especially from a digestive point of view. So the biggest thing I find is that the calorie requirement is just less. If you ever around a lot of older people, I'm giving a talk tomorrow where I think there are going to be a lot of retired people, and there is a catered lunch that the hosts were kind enough to arrange. And I bet when you look at those plates, they're eating really small amounts, because by the time you're in your 80s and 90s, or even your 70s and 60s, you just don't need as much food. You're not as active, and metabolically things are different too. So it's important to be reactive to that. Okay, today's going to be a little bit of an abbreviated office hours, because I have something coming up later. I'm actually doing a live at 4 with my friend Vincent Pedre for his new book. And I have little stuff to do in between. So we're going to not go all the way to the hour. We're going to go to about another 10 minutes. So I'm going to stop talking here. I know I've given you very general brushstrokes and probably not specific advice, but I'm always a little wary about giving very specific advice on here, because as much as I'd love to know you, I don't know you. I'm not your doctor. And I always want to provide that disclaimer that I want to sort of arm you with some food for thought and some information so that you can have well-informed discussion with your doctor, and you can start to raise and think about some of these things. But the advice I'm giving you here should never be prescriptive, like, oh, I'm going to go, get off my hormone replacement therapy because this gastroenterologist on Instagram said I should. Okay. All right. So what do we have question-wise? Let's see. Scrolling through here. I should probably figure out some way for you guys to send me questions ahead of time before the office hours, so I don't have to scroll as much. But feel free to pop some questions in for anybody who's joining us. And let's see what we have. I don't see any questions yet. All right. Beautiful Curves says, help me, menopause is not being nice. Beautiful Curves, I feel you. I'm so sorry. But I want you to remember, consider the alternative, that we're not here, that we don't live it long enough to be menopausal. And it is, it's tough. And let me just remind you of something which is probably going to depress you, but I think it's important to know this, to put it in perspective. Nature does not want us reproducing. The last thing nature wants is my 57-year-old egg getting fertilized. That is a disaster as far as nature is concerned, because my egg is as old as I am. And by the time an egg reaches this age, it's very faulty in terms of the DNA, etc. It's, it's been there since I was born. We're born with all our eggs in our ovaries. And so an older egg, really an egg over, 40-ish, is a lot more things can go wrong genetically with that. So nature's goal, Beautiful Curves, is to prevent you and I from reproducing. And how does it do that? It gives us gray hair. It makes everything droopy. It dries out our vaginas. It gives us belly fat. It literally, I'm not kidding. These things are literally designed to make you less fertilizable. I mean, just think about vaginal atrophy. Like, why does that have to happen? Why? To make sex less convenient, more painful, so you will have less of it, so you are less likely to reproduce. Crazy, right? So you have to keep that in mind. So you have to work a little more at these things. Now, when it comes to, again, I keep veering into the OBGYN zone. So when it comes to things like sex after menopause, you may have to use more lubrication. You may even think of a topical estrogen cream like estradiol that can help with vaginal dryness, that can help with frequent urinary tract infections, etc. Again, ask your OBGYN about all this. Don't take my word for it. But there are things that can be done. If the issue is gas and bloating, eating earlier is fantastic. I mean, my goal is always to try and eat my big meal by 2-3 o'clock, like an old person. Or if I'm going to dinner now, I'm looking for reservations. I'm like, where's the 5 o'clock reservation? Good news is you can usually get into most restaurants at that time, because eating a big meal at 8 o'clock, 9 o'clock, forget it. I will feel terrible. So, the calorie shifting is really significant, because again, in everybody, there is coordination with the circadian rhythm, which means our GI tract is most active early in the day and least active at night. But this is exaggerated in menopause. And I think about the amount of food I eat a fraction of the amount of food I used to eat. I mean, except for my smoothie, I try and load up on that. But I look at a meal that I would have had in the past and I'm like, I can't eat that much. I'll divide that up into 2 different meals. So one of the things, and everybody's a little bit different, but one of the things that I find helps tremendously is eating earlier and just eating smaller portions. That can really help. The other thing is, not only is there often vaginal dryness with menopause, but there's skin dryness. So really ramping up the amount of water you're drinking. I find that I require way more water than I used to. And of course, I have to pee a lot more often because the bladder capacity, the sphincter muscles are weaker, etc. So the frequent urination is a part of it. Just, something you're going to have to live with. I have this crazy contraption in my car called I dubbed it the Furinal, the female urinal. And I came up with it during pandemic when my daughter was rowing down on the river, and I'd pick her up from crew practice and everything was closed. You couldn't go into Starbucks and use a bathroom, or even if things were open, they weren't letting you use a bathroom during pandemic. And one day down there, I literally, almost peed my pantalones. And so I was like, oh yeah, this is not happening again. So I went online and I purchased every female urinal that I could find. And I got 5 or 6 of them, and I, kind of tested them out with water and figured out, okay, this one, it has a funnel and then a urinal thing. And it's just in the back of my car. My daughter's so embarrassed by it. And I've only ever had to use it one time, but just for peace of mind. If I'm, driving to Philly, and that can be a 3-hour drive, and I'm trying to hydrate, and at the same time, what if I have to go? And again, I've only used it one time. I know this is TMI, but so just little things like that, can really help peace of mind. And here's the thing, if you have to pee and there's a bathroom, just pee. Just keep drinking and pee and keep going and just sort of move on, right? There's no need to spend a lot of time, bemoaning the fact that, I used to be able to go 8 hours and not pee, and now you're peeing every 3 hours. Just go. What else? Beautiful curves about menopause not being nice. I think you have to be nicer to yourself too. Not suggesting that you're not, but sleep, for example. I was a queen of the night owl, going to bed at 1, 2 in the morning. No way. Brain just doesn't work the next morning doing that. So you need more sleep. You need more exercise. You need more hydration. You need less food. You need, the body, I want you to really experiment and see if you notice a difference. I know for me, sleep is like crack now, and maybe it's not a good analogy, but sleep, when I get a good night's sleep, it is like what just happened. My body, my mind, everything functions so much better. So the responsiveness to sleep and to the lack thereof is really significant too. As we age, it really changes. Our computers in our brain need more time resting, more downtime to reset, to reboot than they used to. So I think just the most helpful general advice I can give you, it's not really gut specific advice, but is to really try and figure out what is a message your body is sending you. In terms of the GI tract in menopause, if you're having bloating, you're having gas, pay attention to what foods are doing that. If it's all the healthy cruciferous vegetables, I don't want you to stop eating them, but maybe eat them earlier, maybe a smaller portion. All of these things can potentially help. And I'm right there with you, sister, wishing you good luck. All right. What else do we have? Okay, from Miller, KJ555. My progesterone is very low and gut motility slow. Shouldn't I supplement? Well, here's the thing. It's not necessarily a simple matter of just supplementing, because if you start taking a lot of progesterone supplements and it's not balanced, that can lead to potentially some types of cancer, right? We don't want unopposed progesterone. So If your progesterone is low, we want to find out why. Is it within the range of what it could be or should be for your age and whatever else is going on? Or is it really abnormally low? If it's within the range of normal, but lower end of normal, then I think you have to be careful about supplementation, because again, unopposed progesterone can lead to very serious problems downstream. So I would recommend, and the other thing I want to say is, you don't know necessarily with 100% certainty that your gut motility is slow because of the low progesterone. Though it may be like you have breast cancer and you're left-handed. Did the left-handedness cause a breast cancer? Absolutely not. So your gut motility may be slow because of an iron supplement you're taking, because you're not moving around enough, because you're not getting enough fiber in your diet, because you have bacterial overgrowth that's causing a decrease in your gut motility. So I want you to be a little bit careful about drawing a straight line between those two things, between saying my progesterone is low and my gut motility is slow, therefore I need a progesterone supplement, okay? All right, I hope that was helpful. Oh, you're so welcome for the information. All right, we have something from D. Barnes P. How can I balance estrogen if I'm estrogen dominant post-menopause? Yeah, and so again, you don't want to get into this, oh, I'm going to take unopposed progesterone. This is supposed to happen, okay? The progesterone during menopause is supposed to drop, and the estrogen drops too, but not as much, and you end up being estrogen dominant. So you don't want to really do anything about that, but you want to make sure that you're limiting your exposure to xenoestrogens. And I didn't talk about it this go round because it's a whole long hour discussion, and I did another office hours on it, but the estrobolome, what is that? It is a collection of bacteria in your gut that are responsible for basically recycling estrogen. So estrogen levels are dependent not just on the estrogen being produced by the ovaries and other glands, but by the recycling of estrogen in a conjugated form, and then it gets unconjugated, it gets reabsorbed into the bloodstream. It's a fairly complicated process, but what's going on with your gut, if the gut bacteria are very imbalanced, you can lead to more estrogen recycling from the gut than you should have, and more estrogen dominance. So I hate to be like all roads lead to the gut, but this is one of those situations where what's going on in your gut can really affect estrogen levels. So, you know, again, the things that are really important: dirt, sweat, veg, try and get outside in nature, eat a lot of vegetables, get sweaty, those basic foundational things, hydrate, avoid excessive antibiotics, acid blockers, non-steroidal anti-inflammatory drugs, all of those things that I talk about for a balanced microbiome. Beware the medicine cabinet. That's often where the damage to the microbiome comes. All of those things are going to help balance out what's going on in your gut and make sure that the estrobolome is healthy and you're not recycling too much estrogen and ending up being estrogen dominant. But, you know, that is a part of menopause. So it's almost like saying, how can I prevent menopause from happening? And I mean, there are things that you can do hormonally, but they're all potentially fraught with side effects, right? You take this extra thing, well, it might increase your risk of heart disease and stroke. And you take that thing, that might increase your risk of cancer. So you have to be a little bit careful how you intervene. And again, this is very personalized advice with your OBGYN. I know most OBGYNs, when they are having the discussion with about hormone replacement therapy, if they're being thoughtful, they're going to ask the person about their personal history as well as family history of things like breast cancer and heart disease and stroke and all these things, because again, the supplementation can affect positively or negatively the risk for some of these things. Okay. Which species of food has the most drastic impact on gut health? That would be the plant foods. So my favorite study, American Gut Project 2018, they looked at the impact of diet on the microbiome, and they found that the number of different plant foods you eat per week was the most important predictor of a healthy microbiome. And by plants, fruits, vegetables, nuts, seeds, grains, legumes, so that's beans, herbs, spices, all of it, right? So when we think plants, we typically think fruit, vegetables, but don't forget the whole grains, the beans, all of that. We can go a step further and talk about microbiota accessible carbohydrates called MACs, M-A-C-S, not the store, not the makeup store, but the stuff your gut bacteria wants to eat. And so these are typically sort of prebiotic foods, high fiber foods. And you notice I said foods, not supplements, because we don't really have any good data that those prebiotic supplements are doing anything, but prebiotic foods. So those would be things like garlic, leeks, onions, oats, all of those things, all those high fiber foods. Generally speaking, ancient healing root, beans and greens is how I would sum it up. So, lentils, my husband's downstairs cooking some lentils for us for dinner tonight. We shall have with some brown rice and some spinach. If you want to throw some animal protein in there, that's fine too, but make sure you get in those beans and greens and a variety of fruits, vegetables, nuts, seeds, herbs, spices. Okay, from Shanna LC, does a true IBS diagnosis exist, or is it always an indicator of something else? What about the nervous system overreacting and the brain-gut connection? Okay, I love this question so much. I personally reject the diagnosis of IBS. I feel like it's a pharmaceutical construct. They needed a diagnosis so they could ascribe a diagnosis code to these medications that the pharmaceutical industry came up with. But when we slice up that IBS pie, we see multiple different causes. We see dysbiosis, we see gluten intolerance, we see lactose intolerance, we see parasites, Crohn's, celiac disease, gut inflammation, microscopic colitis, all kinds of different things. And so to just say you have irritable bowel syndrome, done, here's a prescription, to me is not a thorough GI evaluation. We want to know, why is the gut irritable? Now, the initial experiments, if you will, with irritable bowel syndrome revolved around something called visceral hypersensitivity. What was that? Well, in the experiment, they would blow a balloon up in the rectum with somebody with IBS, and that IBS patient would feel the distension of the balloon and be uncomfortable at a much lower distension than somebody without IBS. So the idea is that when the intestines are distended with air, with liquid, with solid stool, whatever it is, at a lower volume of distension, the person with IBS is uncomfortable compared to a higher volume in somebody without IBS. We have long gone past that basic definition of visceral hypersensitivity. Now we know that dysbiosis, that imbalance in the gut microbiome, is another common etiology for irritable bowel syndrome. And that can be linked to food intolerances, inflammatory disorders, etc. But I never want you to think of like, oh, let me go out and get a probiotic. I always want you to think root cause. Okay, why is my microbiome messed up? What am I doing? Is it a medication I'm taking? Is it the food I'm eating? Am I taking too many antibiotics? Am I blocking stomach acid and that's messing things up? So you always want to, roll those sleeves up, play medical detective, and try and uncover the root cause, because I'll tell you, in my experience, it's often about something that people are doing that's messing it up, that they're unaware of. So they don't need a pill to solve it. They need to stop taking the pill that's causing it, if that makes sense. So I like where you're going with that. And yes, the nervous system. So we know that there is a very robust stress reaction in the gut, and that can significantly affect digestion. It can increase acid production. It can slow down gut motility. It can do all kinds of things. So for many people with IBS, there is a stress nervous system connection. Maybe it's not the only reason. Maybe it's a contributing factor. For some people, it is the main thing. So it's always helpful if you think that is playing a role to try and address that, whether that is with some meditation, deep breathing, exercise, knitting, whatever it is. I went to a medical gala last week, or maybe it was a week before, that my dear friend, Dr. Ida Bergstrom, who's a fantastic internist in town, invited me to. It's a Clinical Pathological Society of Washington. It's the oldest medical society in Washington. I'm not a member, but I am the beneficiary of her membership every year. She invites me to the gala at the Chevy Chase Country Club. And the speaker this year is the new president of the AAMC, the American Association of Medical Colleges. And I apologize, I don't remember his name, but he gave a fantastic talk. And he mentioned this book called Zen Mind, Beginner's Mind. And he mentioned it several times during the talk. And I was really intrigued, so I decided to get it on audiobook. And I've been listening to it. And it's about Zen Buddhism, and it's very basic, but it focuses, like so much of these Eastern traditions, on the breath. And I'm a big breathwork fan. I love Matteo Pistono and Light Watkins, two meditation experts who are good friends and wonderful people. But this approaches it in a little bit of a different way, this Zen Mind, Beginner's Mind. And I've started to really, really focus on the breath in a sort of unattached way, just in, out, in, out. And I do some visual imagery where I imagine just a door swinging open and close and open and close. And it's amazing how it just, as you really focus on that and think about the door open and close, like you just cannot continue to obsess about, you know, I don't know, like my daughter's trying to pick prom dresses, and you know, which dress should she pick or whatever it is, or maybe something even more significant and more stressful than that going on in your life. So just taking a little break from the mental stress that we have all day long. And, you know, some people have really much more significant problems than a prom dress, right? Some people are dealing with trying to find housing or choosing between groceries and the cable bill. So I don't mean to make light of stress and suggest that, you know, prom dress is the most stressful thing going on. But whatever it is, even if you cannot really escape those circumstances, if you can take just a few minutes out of the day and focus in, out on the breath, it is amazing how helpful it is, not just for you in terms of your mental health, but also for your gut health. All right, that was a long answer to your question. Okay, hi, Natalie. Hi, I'm late 30s and noticed constipation the week before my period. All of a sudden, kiwi has been helping, but is it safe to have it 2 to 3 times a week? Yes, kiwi is the best. Kiwi and prunes, amazing. I love that you have found a natural solution. And for those of you who are still looking, let me make a little plug for our new course that is launching May 1st, which is Monday, called Getting Regular. This is a 4-week course, comprehensive, causes, overview, root causes, solutions, meal plans, recipes. It is really a fantastic course. I can tell you something. We are over delivering with this course. Every week I'm like, oh, and we have to add this. I mean, I have put everything into this course, everything that I think you need. And it's really a terrific course. And Natalie, I talk about the kiwi in the course and the prunes. And prunes tend to give you a little more gas than kiwi, but 2 to 3 kiwi a week, not a problem at all. Whenever I have kiwi, I put it in my green smoothie because in the clinical trials, the kiwi and prunes were better than Miralax, which, you know, millions of people take every day, but, you know, is a kind of first cousin of antifreeze, not something you want to be ingesting every day, as opposed to kiwi, which is full of phytochemicals, etc. So I love that you found this, and I'm not sure why this kind of suddenly happened, but I would encourage you to think about what else is going on. Did you change something else? Did you change your exercise routine, your hydration, your diet? Is there something different in your medicine cabinet? Maybe not. Maybe that just came out of the blue, but I love your kiwi solution. Mwah. Okay. From Anna, what are my thoughts on the Beekeeper's Complete Gut Health Supplement? It is a pre, pro, and postbiotic. Yeah, eat some sauerkraut. The supplement industry, I mean, we are having a moment. Everybody wants to take a pill. We have virtually no evidence that these supplements do anything other than put an increasing load on your liver and kidneys. So you should not be taking these supplements. You should be really thinking about how to change your diet. So we know from the incredible data from the Sonnenbergs, from Justin Sonnenberg's lab at Stanford and his wife, and forgive me, I'm blanking on her name, but they do fantastic work. And we know that sauerkraut, kimchi, fermented foods like that are a combination of pre, pro, and postbiotics. What do I mean? They're prebiotic in the sense that it's a fiber from the cabbage, right? In the case of sauerkraut. They're probiotic because in the process of fermenting the cabbage, you're getting a lot of lactobacillus. And they're postbiotic because they're producing all those important chemicals, short-chain fatty acids, etc., that are so essential for our health. We don't have any evidence that in the average healthy person that taking a prebiotic supplement or postbiotic supplement does anything for you. And what I want you to remember, Anna, is that this is an unregulated industry. Somebody can literally take chalk dust from their garage and scrape some dirt off their shoe and put it in a bottle and sell it to you because there is no regulatory oversight over the supplement industry. And so when you see that little label at the bottom that says, you know, these claims have not been proven to heal, cure, treat any disease, believe it. When somebody tells you who they are, believe it. If they had evidence that this was really doing something, they would have an indication for it and they would not have to have that disclaimer. So don't waste your money. Okay. In case you want to know what I really thought. Is acid reflux more common during perimenopause and menopause? It can be because of the decrease in gut motility. Because remember, even though, acid reflux is happening high up in your GI tract, what's happening low down, 20, 30 feet down in your colon, can affect things upstream. So if you find that the bowel movements are sluggish and the motility down below is slow, that can send a hormonal message to your stomach saying, don't bring anything in because we're full down below, and that can manifest as heartburn and things coming back up. So that's how the lower tract can affect it. And also gastric motility itself, fluctuating estrogen and progesterone levels can have an effect on that, on the gastric contractility, and can result in more reflux, which is why it's so important to eat during the day when you're upright, ideally moving around, active, taking a walk after you eat, smaller portions, all of these things. And think about the fat content in your food, because we know that fat is harder to digest and delays gastric emptying. When we eat a meal that's high in fat, let's say pasta with a cream sauce or a piece of meat or something like that, it sends a chemical message to something called the gastric pacemaker, which is a little bundle of nerves at the top of the stomach that control how quickly the stomach contracts. And when it senses fat, it says, oh, we got to slow way down. Fat is much harder to digest. This is going to take us more time. And so that's why a high-fat meal is typically more sating. You feel fuller when you eat something that has a lot of fat. And that's why high-fat foods are more predisposing to acid reflux. So I want you to think about the time you're eating, how much you're eating, and the composition of what you're eating to help with that. Okay, Janet, I'm perimenopausal. My doctor is not helping. Very bloated where it is uncomfortable. Bowel movements are very loose before periods. I'm plant-based and gaining weight. Any advice? Oh my goodness, I'm so sorry to hear your doctor is not helpful. The first thing I would suggest is that you find another doctor who will be helpful. And here's a little tip, Janet. OBGYNs, in some groups, some OBGYNs, which is first of all who I think you should be seeing for help with perimenopause, not just a family practice doctor or your regular internist. So you want to ideally see somebody who's more experienced focusing on that. And within an OBGYN practice, you might want to find an OBGYN practitioner who's only dealing with menopause, who's not still busy delivering babies, right? Now, some OBGYNs do both very well. But in the practice I like a lot here in DC called Foxhall OBGYN, I find that some of the doctors who've, they're like, okay, I did my 3 decades of delivering babies. Now I really want to focus on menopause. Can sometimes really give you more time and can focus more on that. So that's just a little thought in terms of your doctor. And the bowel movement's very loose before periods. We can definitely see plant-based and gaining weight, maybe looking at, I never want to tell anybody, and it would never give the advice to cut your carbohydrates, but if it is not as many complex carbs and more simple carbs that you're eating, you may be developing some degree of insulin resistance. So this is something to look into also. So I want you to find an OBGYN who's a little more focused on menopause, and maybe work with a registered dietitian who's a little more focused on that too, who can help you with the diet, but obviously don't want you to change from being plant-based. Okay. Sleep Shield coaching. Would you be able to advise on red clover tea in relation to impact on hormones and bone health? I could not. I'm so sorry. I have no experience with that. Okay. Thank you. I'm practicing IF, which isn't helping either. Oh, that's really... So if you're doing the fasting and it's not helping and it's, inconvenient to do, then maybe don't do it, right? So don't think so much about necessarily a specific cutoff time for eating, but maybe just think about lightening up dinner, right? Because it may be that in addition to everything else, intermittent fasting is difficult to do. Okay. Oh my goodness, I'm literally going to have to go in 1 minute. But I think I need to do more sessions on menopause, because I'm really hearing a lot of interest in menopause. And as we're looking, I have a wonderful registered dietitian, Olivia Brandt, who's been working with me, helping me develop and organize really all the various content for the courses. And so we're launching Getting Regular May 1st. It's fantastic. We've been working on it for about 3 months, and maybe a mini course on menopause could be helpful, because there's really so much to talk about, right? There's really, from a gut point of view, there's really a lot. Okay, so I'm going to take one more. I'm postmenopausal. I have low progesterone. It's very slow. Okay, this is, I think we talked about that. And yeah, Chanel, we all need a Furanol, right? Definitely. I mean, just for peace of mind. Okay. Oh, 5 to 6 hours of sleep per night. Beautiful curves. That is not enough. Oh my goodness. Not enough. You need more like 8 or 9. So you definitely need to work on that. Samantha Harris. Oh, I'm sending you hugs back. Don't you all love Samantha Harris? She's so fantastic. And she has a new show on. So definitely check it out. Okay, everyone. I have to dash, but you guys are so amazing. And send me any suggestions. Just put it in the comments for office hours next week, but maybe something just focused on menopause. We should do a Zoom so we can all see each other and we can all just, I think that would be so good. Okay, bye everyone.